Good afternoon, everybody. This is Dr. Serge. Welcome to another episode of Search for the Truth. Today, I'm really excited to have Dr. Kalli Hale with us. She's a biological holistic dentist. So, Doc, welcome to the show.
Thank you so much for having me. What an honor, Dr. Serge.
Awesome. And thank you for taking the time to be with us. I know you're really busy. You are helping tons of people. So we really appreciate it. So first of all, tell us a little bit about who you are, what you do, and what's your passion.
Yeah, thank you for asking. So like you said, I'm Dr. Kalli Hale, and I practice in League City, Texas. My dental office is called New Teeth, and my background is coming from a family of dentists. My mom and dad are both dentists. My younger sister's a dentist. I'm also married to a dentist, and my older sister runs the practice and is just wonderful. So it really is a family affair. In a few years into practice, I really fell in love with systemic health and how our oral health affects literally the rest of our body. And along those lines, I became very familiar with dental materials and what I'm using on my patients and how that can affect their health when they leave, and what all the best materials are to use. And that's what we use. And I spend a lot of time researching that. And then in the last 2 years, I spent a long time going through a postdoctorate education on sleep apnea therapy. So we kind of do it all.
That's awesome. And I have to say that airways, sleep apnea is one of your things, right? It's one of your expertise.
Yes.
So let's just jump into it. So can you tell us a little bit how your jaw bones, your teeth affect your sleep and your health?
Yeah, absolutely. So I'm very passionate about it, and I love teaching this now and screening our patients in the practice. So a lot of people will ask me kind of like how, like you are, how does that tie in? How would my teeth have anything to do with how well I'm sleeping? And it's really more of just an indicator for us in the dental chair. If I'm doing an exam on you and I'm finding that you have a lot of crowns, that you have a history of a lot of cracked teeth, if you're tongue-tied, all of that is a huge indicator that there could be something going on with you at night when you're sleeping that you could be very unaware of. Acid reflux is another huge one. If that's happening to you in a way that you're really not aware, so not during the day, you could have what's called silent reflux, and obstructive sleep apnea has a huge tie-in with that too, actually along with hypothyroid. So there's just a whole big picture that I take when I'm looking at you to see, okay, are we missing something? Could you be struggling to breathe at night? Could your oxygen levels really be dropping below what's normal at night, which will cause you to grind your teeth, which could end up with a cracked tooth or a root canal or any of the things that have happened to you so far before you've come in and met me. And that's more of the adult side of it. When it comes to the pediatrics, I'm looking at, have they been diagnosed with ADHD? Are they bedwetting at a later age in life? How's their anxiety? Are they suffering with depression? All of that is so important to make sure that a child's oxygen levels are normal when they're in sleep at night.
So are you saying that those conditions can be triggered or caused by issues coming from the mouth?
Yes. So when your arches are underdeveloped, so for instance, if you have a tongue tie, your tongue is a natural palate expander. And if that tongue is sitting at the floor of the mouth, not the roof of the mouth, helping it broaden, then as the child develops, their mouth will open and they will mouth breathe more at night than they will nasal breathe. And when that happens, the arches are underdeveloped. And the roof of your mouth is the floor of your nose. If I could put that on a hat, I'd wear it everywhere. Okay. So when that upper arch is not properly developed, then the air that's able to get in through the nose is very minimal.
And I have to attest to that actually, because you've been helping my daughter for a few months now. And I didn't realize it when she saw you for the first time. She came back home and she said, "Daddy, I have an overbite." Okay, what is an overbite?
Yeah.
So I have to Google it and all that.
Yeah. So when a child bites down, there should be very little overlap this direction and this direction. And when we're looking at the relationship of the upper and lower jaws, you don't want the front teeth and the top teeth to stick out way far past the bottom teeth. When that's the case, it means the lower jaw is too far back. And when the lower jaw develops too retruded, that airway that goes down the side here is pinched. And that's typically a very obvious indicator that this child probably grinds or snores at night, and needs to have their breathing evaluated by an airway center dentist.
Wow, that's impressive, actually. And I have to say that since you've been working with her, she's been sleeping better. She feels more refreshed when she gets up, and she's calmer.
Yeah.
And this is a few months or whatever you did with her. So,
Well, when you sleep at night, if your oxygen levels are dropping, and I know you're well versed in this, Dr. Serge, you spend a very large majority of your night in fight or flight mode. And a child, especially experiencing night terrors, typically when the kids are little, I'll say, hey, do you get bad dreams at night? That's kind of my filter question. When they're experiencing those night terrors because their sleep architecture is off and they're having too much adrenaline squirted in the body when they should be resting, they're like crazy during the day.
Wow.
Yeah.
That's amazing how the mouth can have so much impact on the body.
Yes.
So what would be the signs that we need to look for our kids to see if they have any problems with the airways, the breathing, the mouth, the teeth, so on?
Yes, that's a great question. So I actually had a teacher in my chair today, and she shared with me that during her years of teaching, she would have children in school that would fall asleep at their desk.
Okay.
Occasionally she would see them snoring. But the biggest issue that is literally plaguing America right now is the ADD, ADHD diagnosis.
Yeah.
And if you typically, the underlying cause of that can very much be an underdeveloped craniofacial structure. And it's just not common knowledge. Not all the dentists are trained in this. And the teachers are dealing with these kids day in and day out, trying to help them learn. And they're seeing that disconnect in their ability to focus and process and kind of deal with the day, right? And so the treatment is to go see their MD or their pediatrician, which typically the answer will then be pharmaceutical. And that is where I have so much passion for what I do, because if we can get these children off of these medications because they need to breathe better at night, then that's what we need to do. Many of these medications, and I never judge a parent for choosing that. We are all doing the best we can. If it is needed and that is what your child is on, that is okay. I would just love to be on that journey to help them get off of it, especially if some of the medications are not even really approved for under 18 years old.
So how many of those kids actually have physical issue, like structural issue with the mouth, the jaw? Is that a big
one I've seen? Everyone I've seen. So
wow.
if your child's teeth are crowded, that we don't need to wait until they're 13 or 14 and doing braces. I mean, when the child is developing, by the time a little boy or girl is 4 years old, they're like 75% developed in their head and neck structure, like massively larger than people realize. So the old school method of waiting until all the baby teeth fall out and the permanent teeth come in to put braces on and force the teeth into a certain alignment is no longer, especially for me. If I can get the kids taken care of at the 4, 5, 6, 7, 8-year-old range, their teeth line up beautifully and can sometimes save thousands of dollars in orthodontics and years of therapy for the kids.
So at what age then the parents should bring a kid to a dentist like you?
Yeah. So typically by the eruption of the first tooth, we like to have a happy visit, which teeth, we do not charge for that. I just want them to come in and see that place. And I don't want any kids to be scared of me. The earlier that a dentist can put their eyes on those little erupting teeth to make sure that sugar, as you always probably talk about in your office too, is not a part of their diet. We just like everybody to get familiar with the office. By the time they have all their baby teeth in, if they have been sucking their thumb, if they have been using a pacifier for most of those years, I will already be able to see changes in the skeletal structure. Pacifiers when they're newborns are very much needed for everybody to sleep at night and all of that. But by the time the child's 1 or 2 or 3 or 4 years old, they do more damage than they ever do good.
I see.
Yep.
Okay. And what about kids who are younger? Do you help with, because, sometimes people struggle with the kids, they don't sleep well at night, so on. So is that something you can do as well?
Yes. So actually the youngest age that we've started in what we call the tooth pillow for these kids that are struggling was 2.5,
Oh,
which is
wow.
very,
Okay.
very little. I tend to think the 4-year-old range really is just easier on everybody with the parent of getting them to wear this little tooth pillow and all of that. But when the really severe ones need it, they need it and we do it.
I see. Okay. So this is for the kids. What about for us adults?
Yeah.
You know, I
Good
think lots
question.
of people with sleep apnea, they use the CPAP machine. You
Yes.
know, it's annoying. They don't sleep well. So
Right.
what would be options for them not to use CPAP?
Yes. So it really depends on their severity. Okay. I take my job very seriously with the adults. I get a lot of people that come see me because they want to get off their CPAP, and I am very excited to help them do that. I have successfully done that many times, but it really depends on their weight, their health overall, and how bad their sleep apnea is to begin with. So the apnea hypopnea index is the gold standard number for how bad somebody's sleep apnea is, right? So that is the number of times that somebody stops breathing per hour for
Yes.
longer than 10 seconds, right? So if their apnea index is in the 50s, then they're going to need a CPAP for quite a long time while I'm trying to help them. If it's a lot more manageable, then they could get off it in mere months. It just depends on the severity of the case, and it's all case by case basis.
Wow. And so what do you do specifically? What do you use instead of a CPAP?
Yes. So I am a proud Vivos provider. I use the DNA appliance or the mRNA appliance to successfully expand an upper jaw. And that is something that is very new in medicine. I would say a decade, which is like a heartbeat, in my opinion,
Yeah.
especially at the slow rate of change that things tend to happen in the dental and medical community. But we do expansion. That's one of our options to correct the underlying craniofacial abnormalities. And it is possible as an adult. That was not something I was taught in dental school. They kind of said, once you're past puberty, you're, good luck. You're kind
Yeah.
of who you are. And that's not true. That's been proven to not be the case, which has been life-changing for my patients. I have a patient in particular I could discuss who had a starting AHI of 39. It's severe sleep apnea. We got him off his CPAP in 5 months. And at the end of the expansion therapy, he was mild with nothing in his mouth at all. So it is definitely possible. And he was 62 years old when we started.
Wow, that's impressive. I mean, like I tell my patients all the time, everything is possible. You just
Yep.
have to find the tool and the answer to get there.
Amen.
Oh, amazing. You know, you're not an ordinary dentist, right? You are more a biological, holistic
Right.
dentist. So what's the difference with that traditional dentistry?
That's a great question. So I think it just stems with my continuing education. There are so many wonderful things you can specialize in dentistry now: cosmetics, orthodontics, airway, all of the things. And for me, I wanted to make sure that if I was putting a material in your mouth, that I knew that it was safe, effective, and not going to harm you in other ways. And so the more I researched materials, the more I started to have opinions on the materials too.
Yeah.
So the biggest controversy I think right now in dentistry is amalgam, of course, because it's mercury. It's half mercury. It's actually 51% elemental mercury for anybody that wants to look that. So I just, if it needs to be removed and replaced, it's just done with extra protocol. I want to protect the patient. I certainly want to protect myself. And you should see what the city requires for my water filtration. They don't want amalgam in the water, and we have to pay a lot of money to make sure that it's all safely evacuated from the operatory in and it doesn't get in our water supply. So that should probably tell you about whether or not you want it in your mouth, but we'll just kind of leave it at that.
Yeah. Which was my next point, actually, because you are a smart dentist, right? You're smart certified.
I love that title. Yes.
I know, right? Because you are smart because you do the right thing.
Thank
So
you.
what does that mean?
So you can, dentists can join the International Academy of Oral Medicine and Toxicology, and they have an education program in their academy. And one of them is to become what they call SMART certified, which means you do it safely. You do it differently. Your patient's on oxygen. You protect the oral mucosa from all the metals that will be spraying around. It is an alloy. It's a mixture of different metals. It's kind of a no-brainer when you think about it, but it's just not always commonplace. And so I joined that academy, and there is so much information online. It's the IAOMT.org website. Patients can actually find providers in their area that are also certified in this, and get a lot of really good articles online.
Good. And I have to testify to that because one of my very first patients, she came to me, she lost her vision in her eye because a chiropractor said, listen, you have failings in your mouth, it's toxic, go see your dentist, replace them. She had no idea what to do. She went back to see her dentist, they removed everything, and the mercury vapor got into the eye, and she lost eye on one side. So you guys do it the right way. So why are dentists today still using something that much toxic? I just don't get it. I know it's a tricky question for you to answer, but why after so many years
unfortunately, I think the easy answer for you, Dr. Serge, is politics, unfortunately.
Okay. And is it true when those amalgam fillings are stable in your mouth or safe in your mouth, or stable when you chew or drink?
So that's where the controversy lies. I would say they are absolutely not stable, especially in the amount of patients that I see that have bruxism or grinding.
Yes.
IAOMT.org website actually has videos where they have taken an extracted tooth that had a dental amalgam. They've done some scraping on it or toothbrushing on it, and they can see that the particles do emit from that. So that is just a big rabbit hole in dentistry where we all try to figure out, why are we doing it? Why is it still being used? The plain and simple answer is that it's a material that can be placed very easily and quickly in a wet environment, and it's very, very strong. But the systemic health answer would be, not to use.
Yeah, exactly. I'm always puzzled by that. Why we still use that today? So you guys use something different.
Right. So absolutely. Yeah. And I will, just one more caveat on the amalgam, I'll tell you, throughout my studies, they really have studied dentists in particular, which is why the amalgam worried me as I was researching more about it, because I really had no idea when I got out of school that it could be dangerous for my health. Unfortunately, dentists have one of the highest suicide rates of all professions. Wow. And when that happens, an autopsy is done. Okay. And they found 800 times the more mercury in a dentist's pituitary gland.
Wow,
okay.
Unbelievable.
That wasn't enough for me to wear a respirator and put some oxygen on the patient and the rest of the SMART protocol. I don't know what else would have been.
Wow.
So I do it as much for my staff so that when you're walking in my office, you're not just bombarded with whatever the heck we're blowing around in the air. So it really is very important. But then, as you're right, as I researched what I did want to use, I had to figure out what I did want to use, right? Because when I learned that maybe something could be harmful with something I thought was whatever, we just all do it. This is what we use. It's not what we use, and it shouldn't be it won't be what I'm using. I found a ceramic filling material that really truly was BPA free, because the next caveat is, now I have a traditional composite in my mouth. I do not stress about that to an extent, but we do have some patients who are endocrine compromised. And when you can convert a bis GMA to a BPA, which is what happens with the composites, it can harm you. And the more I pay attention, the more I just have to know what's going on with my patient, so that I know I can put my head on the pillow and sleep well at night, that I didn't do anything that's going to hurt them. So this ceramic filling material is incredible. I actually had the rep down to talk with me about 5-6 years ago, and we sat there and talked biomaterials. She is phenomenal. She's one of the smartest dental reps I'd ever had in office, and that's what we have used across the board in all of our practices. It's a wonderful material.
Awesome. So if people have failings, mercury failings, so what would you recommend?
If they are deteriorating, if they're cracked, and we feel that they need to be replaced, the only way it's going to be done in my office is with the SMART protocol. So that's a conversation I have with each patient on an individual basis. I certainly don't go in and go, oh my gosh, you have them, they all have to go. I don't like decisions to be made out of fear. What is your medical history? What is Dr. Serge saying you need done? What is Dr. Siddiqui saying? Whoever I'm with, what are we doing here and how can I help you? But then the clinical exam, gosh, I mean, if these amalgams have been in for 2 or 3 or 4 decades, like there's probably something leaking there. And we can see that with a simple digital x-ray or a clinical exam and take care of you that way, the right way.
The right way, exactly. It reminds me of a study that was done in Japan. that doctor was an oncologist, and he wanted to see what was common among all those different types of cancers. So he tested about 70, 80 different types of cancers, and they found one thing in common among all of them, and it was mercury present in the cancer cells. So that just shows us how toxic it is. And that's what I tell my patient as well. I said, don't go crazy with your mouth yet. Let's make sure your detox pathways are open, your body's strong enough, and then you can replace the fillings and then do a really good
no
detox.
difference when we go in and do it. It's not all at once. We don't cross the midline. We take meridians very seriously in this practice too. So
Yes.
it'll be either one quadrant, it'll be one side, depending on the health of the patient for sure, because the severity of their immunocompromised status plays a huge role in how we plan all of this. So you're absolutely right. And honestly, I have no idea why this is even controversial. I mean, in every other form, elemental mercury has big warning signs. And I don't need to get on that soap. I don't understand. Like, I don't.
It's crazy to me because when I was working in the hospital years and years ago, we had a mercury spill.
Yes.
And the whole department came and we closed the whole floor and we couldn't work for a day there, and they decontaminated everything. And we put that in people's mouth or different products, actually. It's really crazy to me. So we have a question from someone here, from Miss Sarah. So she wants to know your thoughts on crowns being used when you have a chipped tooth. Any safer alternative than crowns?
Crowns, when made properly, are very safe. And if it prevents you from splitting the tooth in half and needing a root canal, which I don't love, or an extraction, crown all day long. The best thing you want to ask your dentist for is that they use a zirconia, that they use an all ceramic, so you're not mixing different metals in the mouth. Crowns can be made from a slew of different materials, depending on the aesthetic requirements as well. But if it's a back molar and it's chipped, then that means you might be grinding, and that means you might need an airway consultation. Okay. What I personally love, and I hope one day with my mentorship and teaching, is that we stop letting patients break their teeth because we're missing the signs of breathing problems.
And you were telling me earlier that the last year or so, you've seen so many people stressed out and coming in with chipped tooth, actually, or cracked teeth.
Yes. It's just been a stressful 1.5 years for the country, for the economy, all of it. Yeah. And that stress can really take a toll on our teeth. So if you're waking up and you have generalized sensitivity or your muscles are sore, there's a lot happening.
When we sleep, we don't know what's going on, right?
Right. No. Oh my gosh. Amen. That too. I don't know how many people will say, do you snore? And they're like, nah. And then the wife or the husband's in the back like, yeah, they do, because you're asleep. So you really might not have any idea, which is why a good dental exam and a home sleep apnea test is so nice. I can send you home with my machine. We can screen you, make sure it's okay.
Wow.
And it's just really, really good.
This is amazing. So people with sleep apnea, or they are concerned with sleep apnea, they don't have to go see a sleep doctor. They can actually go see you and really figure out the root cause.
Yes, in the state of Texas, dentists can administer home sleep tests, which is just crucial. Our medical doctors are very well versed in this as well, but they're very, very busy. And honestly, I feel like I see my patients on a more regular basis. Every 6 months, they come in for their cleaning. I don't want to miss it. And I tell my patients that no matter what, I don't want to miss it. Whether I help you with it or not, if you have it, you should know. And that could be a really big piece to their puzzle of their health. Everybody's talking about adrenal fatigue. Everybody's talking about being hypothyroid. If you're hypoxic for hours on end at night, well, no wonder.
And I do see that, like you said, people are so stressed. The stress hormone is so high. The circulation is not good. Oxygenation is not good in the tissues. And that part of it could be the way they sleep or they breathe.
100%. Yeah.
And you said a few minutes ago that you use zirconia composite.
It's actually ceramic. Yeah, ceramic. I don't use the word composite because of just the technicalities of the material. It is actually the only chairside ceramic material that exists, and a lot of wonderful biologic dentists and others that are learning about it are using it because it's beautiful and it handles really well, but it's safe. It's safe and non-toxic.
That was my understanding. It was safer than like titanium, for example, for implants, right?
Oh, for dental implants. Yeah. Yeah. Oh, yeah. That's a whole other conversation. We
So
can
that's
do
another conversation.
just
Okay.
on that. Yes, absolutely. But there are alternatives in the office of ceramic or titanium. And again, it's patient by patient and their health needs. Yeah,
I
absolutely.
see. We have another patient, another viewer who asking a question about root canals. So
Ooh.
how do you guys handle and address root canals?
Yes, absolutely. So I mean, I feel like we're going into all the rabbit holes
I
today.
know now all questions
So,
now.
so in our practice, if you want to have your root canals properly identified and screened to make sure that they're not making you sick and they're not infected, we do that with a 3D CBCT we have here in the office. When we take a traditional dental x-ray, that is a 2D image of a 3D object, and you can miss latent infections and underlying problems with the tooth by just that close-up. The close-ups are great for a lot of other things, but if I'm going to tell you that your root canal is okay, I need to see it in 3D. And if it has an infection, you very likely will not ever know. The root canal procedure in and of itself was to remove the nerve tissue, which means we've removed your ability to know that there's pain or that there's something else going on with that tooth. So it's really important that we make sure that if there is an infection at the end of one of those roots, that we talk about the best way to handle that. Sometimes I see people that have 7 root canals, and I'm not in there going, we need to rip all your teeth out. Like, no, not at all. But if there is one that's infected, we can biopsy it. We can find out exactly what bacteria or amoebas in some instances are living in that jawbone. And what I need the patients to understand is that that is a low-grade chronic infection that is circulating through your body every day. And we don't want that. I mean, we're fighting anti-inflammation and all the time. I mean, for our systemic health. And if it's infected, we need to talk about the best way to go about fixing it.
So can you talk a little bit about the link with root canal that are infected with brain and heart health?
Oh my gosh, absolutely. So I think the easier correlation for people to understand is the history of gum disease or bone loss around your teeth and needing the deep cleaning. That bacteria that stays below the gum or hides in a root canal has been identified in heart attack patients. They've biopsied the saliva or the blood or the tissue around the root canal to the heart plaque, and it's been the same. That's not news. That's not fancy biologic dentistry. That's science. That's been known for a very long time. If you have gum disease and you have heart disease, you better be up to date on your cleanings and everything. Your gums should never bleed. If they are bleeding, something's wrong, and we need to get in there and clean it out and make sure that that stops. So it's no different than having an infected root canal. It's very much linked to heart problems, and we just want to keep all that bad bacteria out of your system.
Yeah, correct. So root canals, I mean, I used to work with an oncologist, and he would treat his patients naturally. But the first thing they will have to do is to remove all fillings and all root canals.
Yep.
Impressive, because those can be infected. Like you said, it can cause a lot of problems.
Absolutely.
And people don't even realize it.
Yeah. I've had wonderful success stories. I've had people who have removed their amalgams and gotten off of their hypothyroid meds. I've had people take out an infected root canal and have a lump in the breast go away. And it would be a particular tooth that was on the breast meridian. We go through all of that. And it's just insane because it's so new to social media and the traditional office. But it's not for us. And we hear these success stories every day. And it just gives me motivation for what I do.
That's amazing. So you guys are really holistic. You look at the totality, how the body works together, different parts. This is so impressive. We have other questions. So somebody asked, what's the best toothbrush? Soft, medium, hard?
Soft. I'm so glad that got asked. I think my hygienists, who are amazing, shout out to all of them, would be so proud of me for saying that, of course. But soft is the best. If your dentist has ever told you that you're brushing too hard, or they see that you have like worn on the tooth, I would get a second opinion on that, because again, it could be from your bite. It could be from grinding or clenching, because it's kind of an older school thought that, oh, you're using a hard toothbrush and you're braiding it away. They actually know now it has a lot more to do with alignment of the teeth. So if you have a little bit of what they call malocclusion, or the teeth are not lining up great, you might want to consider asking your dentist about that to see if it could be something else.
Okay, good. Thank you. Another question. Somebody wants to know what's the best foods to eat to optimize our dental hygiene and cavity prevention.
No sugar.
Oh, that's
in carbohydrates. The bacteria in your mouth don't know the difference if it's sugar or it's a bunch of potato chips, you know. You really can't outbrush the sugar. You really can't. You can't go sip on a Coke for 2 hours and then brush your teeth and expect that that's going to do anything. The real biologic link between what's happening with our decay in our mouth is actually more what hits our stomach. So when you eat something sugary and it hits the stomach, your parotid gland changes the acidity of the saliva. So it has a lot more to do with the saliva that's in your mouth, which has to do with your gut health. Yeah. Dr. Serge can hook you all up with good, proper gut health. But that's what we're seeing is the diet is all of it. It's not genes, unfortunately. You don't have cavities because your dad had cavities. You probably just have a very similar diet to your parents because that's where we grew up and ate. And yeah, sodas keep me in business.
Unfortunately, that's the case for me as well.
Yeah.
And I was really impressed actually because years ago, I sent you one of my young patients, 4 or 5 years old, for a second opinion because they went to go see the dentist. They wanted to do all those fillings. I think it was 7 or 8 fillings because of cavities and different things. I said, that sounds a bit ridiculous. Go see them. And the verdict at the end of the day was, let your body heal the cavities. And you were right. A few years later, the cavities were gone.
Yeah, absolutely.
So
nutrition is everything. Nutrition is everything.
Diet, sugar. Listen, It's been 30 minutes already. Time flies.
Yes.
So for a last statement, anything you want to say to the listeners?
If you're in this area, I'd love to be your dentist. We offer complimentary airway screenings. I also offer a dinner once a month to learn more about sleep apnea. So you can call our office, 281-554-9090, if you would like a consultation on sleep apnea.
Awesome. Again, Dr. Kalli Hale, thank you for your time.
Thank you, Dr. Serge. Absolutely.
So, awesome. Have a good one. Thank you everybody for watching.
Absolutely.